Next, we'll hear from Catherine Blakemore from Disability Rights, California.
Thank you. It's a pleasure to be here, and I want to just talk briefly from our perspective about the implications of inadequate service coordinators at regional centers and the need for also specialized expertise at the regional centers. The system that we have developed over time has become increasingly complex. A lot of the changes in the law that we did during the recession require greater access of generic services, which means that you need people to help you access those generic services. And by having high caseloads, it also makes it harder for individuals to access the services they need from the regional centers. Just briefly, two examples. I was at a regional center in Los Angeles earlier this week. A monolingual Spanish-speaking mom identified that the service coordinator had identified a social skills training for her daughter, which was located halfway across Los Angeles, which we all know is quite large. And she could only get there by bus. It was at a specific time during the day. Took 2 hours each way to get there, but that meant she couldn't actually pick up her other children from school because she was going to be on the bus. So she just didn't get the service, and she couldn't reach her service coordinator to talk about what other ways she might be able to get that service, which might be going to her local recreation center and having some supports provided there. So that's an example of the kind of barriers that people have accessing services from regional centers. Because they can't adequately reach the service coordinator who could provide them very capably with that assistance. The other example is because we've done things like require everyone to go into managed care, people need assistance in accessing managed care services. Managed care providers have unique rules that say, oh, we don't provide that, the regional center provides it, or we don't provide that because school districts provide speech therapy. And so consumers and their families end up in this very much catch-22 of trying to figure out who's actually supposed to provide the service. And a key function of a service coordinator is to help untangle that sort of web and help people access those other services. Finally, there's also a mandate in the law for specialized expertise at each of the regional centers. And in our experience, as you know, the cost of providing case management and other services has decreased, the funding for that specialized expertise has gone away. Those provide critical functions such as people with criminal justice expertise that actually help consumers stay out of jail and avoid incarceration. That's a really good outcome. There are individuals who help people move from segregated kinds of facilities, whether it's a state institution or something locked into the community. Another really valuable service for individuals. We've recently identified the fact that many people have difficulty accessing dental services. And in this Greater Sacramento area, there's no longer the availability of anesthesia dental care because of the low rates at which Denti-Cal reimburses that. So access to someone at a regional center that could help provide that would be of great assistance. So with those sort of implications of what does this mean, we would say and encourage you to do the following. First, target additional operations dollars to address the caseload ratios that will ensure a more effective and efficient system. Those are real people who can help consumers and families access what they need. With those additional funds, think about outcome measures and how those outcome measures can be used to help us meet the new federal guidance relative to home and community-based services. Are people getting the kinds of choice and autonomy that they need in their living arrangements and in what they do during the day? And then ensure as a piece of this operations piece that the critical specialized services which can help with transitions and avoiding incarceration and accessing services like dental services are available. Thank you so much.
Thank you very much. Senator Stone, anything? Okay, thank you very much to the panel. That was helpful as we have our oversight responsibility over this critical issue. We'll move now to issue number 4. Regional Center Purchase of Services, page 15 of the agenda. And we'll be focusing on the governor's proposal.
This issue, Madam Chair, deals with the, again, the current year and budget year increases, the current year deficiency as it impacts the regional center purchases services side. And again, as the agenda points out, we're seeing a significant increase in both in current year that carries over into budget year. And these increases are related to increases in the services that are being provided as individuals transition out of the developmental centers and into the community. We're seeing increased costs for supported living services, and we're also seeing increases that are related to higher caseload. So we also have a proposal that is part of the current year deficiency and the budget year increase related to SB 946. That's Senator Steinberg's bill that requires insurance providers to pay for behavioral health treatment. Anyway, that proposal, when that bill was signed, we estimated savings of $80 million. We're seeing savings more in the neighborhood of about $36 million. So we're proposing a general fund increase to cover the difference of about $44 million. So those are the significant pieces of both the current year increase and the budget year increase.
Could you address the question on page 16, please?
Absolutely. The LAO correctly notes that there is an increase in our non-matched general fund expenditures, and it's outpacing our federal fund drawdown. And we do agree that this is a concern. We're not certain at this point of what's causing the discrepancy. There are a number of factors that we think could be contributing to this. One of the areas that we're examining right now is how federal funds were treated during the years that we were implementing cost containment measures. During those years, there was a push to make sure that federal funds were impacted to the least extent possible. We tried to keep federal funds coming in to the extent that we could, and as a result, what happened, some of those proposals that we thought were going to save federal funds or not impact federal funds, we weren't as successful as we would have liked to seen with, we did lose federal funds in some of those areas. We didn't adjust budgets accordingly in some cases, so we think that may be part of the issue as well. But again, this is something that we're continuing to look at and hope to have a more clear resolution by May revision.
Okay. Senator Stone.
I'm a little bit confused because I'm sure in order to maximize the utilization of federal funds, you have to meet certain criteria, right? So obviously we're not meeting certain criteria to tap the federal funds. So is that the services that are being provided are not those that are recognized by the federal government as something that they partner with us on? I want to make sure that we're not leaving federal funds on the table because we're not doing something on our end to show the federal government that we are entitled to those funds. So
Yeah.
I'm puzzled that at this point in time, we don't understand why we're not maximizing those federal funds.
Well, and I appreciate the concern, and I think that to be clear, we maximize federal funds to the extent we can. We have, I think, done a very effective job of bringing in any federal funds that are available. We were able to go back. We reached an agreement with CMS to be able to go back and bill for specific services back to 9/10, and so those federal funds that we're able to draw down replaced what were general fund expenditures. So we've been effective at that. I think to clarify my point, we had some proposals that we thought would only have limited impact on general fund when we took, or I'm sorry, federal funds when we took the general fund cut. And instead, what happened was some of these cuts also influenced federal funds, and we reduced federal spending more than we expected to.
Okay, so as we hopefully restore funding to the program, I would assume that that would enable us to better tap the federal resources that are available to us to augment our programs.
Correct.
Yeah, thank you.
LAO?
Thank you, Madam Chair. Rashi Kesarwani with the Legislative Analyst's Office to provide an overview of our analytical findings on the department's projection of greater utilization of services. The department is projecting significant cost increases for general fund expenditures that do not draw down federal Medicaid matching funds, known as the non-match general fund, for specialized adult residential facilities that fall under the community care facilities category, as well as for supported living services that fall under the support services category. And we took a look at both of these two categories during our analysis. And as the agenda notes, the non-match general fund portion of support services, for instance, is estimated to increase from $81 million for the 2014-15 enacted budget appropriation to $160 million for the 2015-16 proposal. Obviously, this is a significant increase of $79 million, or 97%. And this growth deviates significantly from the cost growth that we saw in previous fiscal years. We looked at the last 3 fiscal years. We appreciate Mr. Doyle's comments that the department is continuing to look into this issue. Thank you.
Senator Stone, anything? Great. With that, we'll move on to issue number 5. Again, focusing on the governor's proposal, page 17 of the agenda, sick leave.
This issue reflects the increase that the department is proposing related to Assembly Bill 1522, the Healthy Workplaces, Healthy Families Act of 2014. The governor's budget proposes an increase of $25.3 million total and $16.2 million general fund to provide sick leave benefits to employees in California who work a specified number of days in the calendar year. The way that the department developed this estimate, we didn't have specific information on the number of employees for each service provider. We have thousands of service providers, so we don't have detail on that. But we made assumptions about the total number of affected employees based on required staffing ratios and the type of service that is required to be provided. And then to determine of those employees how many might not have health care coverage. We looked at, we used the bill analysis for AB 1522. The Assembly had done an analysis, and they were projecting approximately 39% of employees wouldn't have benefits, so we used that as a percentage. And we did work this estimate through. We shared it with the Association for Regional Center Agencies, but we've also included trailer bill language to implement the proposal. So that's basically how the proposal works.
And so based on the amount of information you didn't have in terms of hard numbers of employees, you know, what will be your plan if your guesstimate is off, if you underestimate?
Well, if we underestimate, unfortunately, I think we'd be back, looking for additional funds. We'll have another opportunity at May revision to look at these numbers to make sure that they're tracking to what we're seeing. But
LAO?
Thank you, Rashi Kesarwani. We recommend approval of the governor's proposed augmentation related to the new paid sick leave requirement. We further recommend that the legislature require a supplemental report from the department on the actual general fund cost for this proposal, given the data limitations that Mr. Doyle just described. This information would enable the legislature to assess the degree to which the department's estimating methodology may need to be revised in the future.
And one potential revision is, you mentioned ARCA, who represents the regional centers, but any plan to dig a little deeper into the direct provider groups between now and May revise?
We'd be happy to include other groups in reviewing our, if they're interested in reviewing our estimates and how we derived them.
I just think in terms of trying to get you all the data possible to make sure that this number is right, because we want to take full advantage of the unique opportunity the new law gave and make sure that we provide the sick leave coverage to as many people who are eligible as possible. So beyond the Regional Center Association, direct provider groups, as it's reflected in the staff write-up, I think would be helpful. Finance, any comments? All right. With that, we'll move on to issue number 6, minimum wage increase. Again, the governor's proposal, page 18. We'll be joined by Will Sanford, who's the executive director of Futures Explored. And again, we're reviewing the governor's proposal. We'll start with the department.
Thank you, Madam Chair. For fiscal year 2015-16, the budget is proposing an increase of, a total increase of $64.2 million, 36.6 of that is general fund. And this will fund the minimum wage increase when the minimum wage moves from $9 to $10 per hour effective January 1st of 2016. Of the total amount proposed, 62.3 million is related to regional center purchase of services. So these are for the types of programs and services that typically have minimum wage employees. So it would be community-based day programs, work activity programs, respite care, things like that. The remaining 1.9 million is targeted for regional center positions such as entry-level account clerks and entry-level secretary positions that are currently earning minimum wage. All mandated employer costs, such as Social Security, Medicare, and workers' comp, were all factored in when coming up with the estimate. So the expectation is that providers who have cost increases in those areas can submit requests for that funding.
Could you take a look at the questions on page 19 in terms of, has the number or type of program
Yes.
impacted changed this last year?
No, the same types of services are included that were included in our estimate and our methodology when we increased the rate from $8 to $9 for minimum wage. What we do assume in this year's estimate is that by going to $10 an hour, that more employees and providers are going to be impacted. You also asked if we have looked at the legitimacy of concerns that providers have raised about secondary costs.
And which are summarized on page 18, yes.
Absolutely. And we are aware of the concerns that have been raised, and particularly with the issue of twice minimum wage for supervisorial staff. And we're familiar with the requirements that are in the California Labor Code. However, our proposal, given, again, resources that are available, doesn't attempt to address this issue. We are only providing funding that is sufficient to take employees who are at $9 an hour to $10 an hour.
It's just really kind of following the letter of the law, I would assume.
We're providing the funding, yeah, that we can. We're making sure that other associated costs for those employees are covered. That's what we have resources for. And then just to provide an update on where we are, because this was an issue previously with the current year increase. We're required to report on how we're spending the funding. We received $106 million associated with the current year increase from $8 to $9 an hour. And at this point, it doesn't appear that we're spending below the $106 million an hour estimate. but we're continuing to monitor it, and we'll provide an update at May revision.
Okay, great. LAO.
Thank you, Rashi Kesarwani. We recommend approval of the governor's proposed augmentation related to the minimum wage increase. As with the sick leave proposal, we further recommend that the department provide to the legislature a supplemental report on the actual general fund cost of the augmentation. Again, given the data limitations in developing the department's estimate. And as before, this information would enable the legislature to assess the degree to which the estimating methodology may need to be revised, particularly given the possibility of future minimum wage increases.
Thank you. Mr. Sanford.
Thank you, Senator Mitchell, Monning, and Stone for the opportunity to try and represent our direct service professionals and first line supervisory staff, of which, sort of in this mix. First off, we're very thankful that the government put into the mix over the last 2 years funding for the minimum wage increase at a baseline. However, clearly the couple groups get left out of that mix. One is there's really no differential for those people who have long-term career aspirations in our field that have been with us for a number of times and/or are in high-cost areas and/or professional fields that require a higher degree of salary. So this does not impact them or benefit them in any way. We simply bring up the floor. It's great for all of our direct service staff who really need that, so we're very excited by that. It also doesn't address, as we talked about, as the front level supervisors who really are in the front line of helping us hire, train, promote, make sure that all the standards everybody expects are met, that people are safe, that people are in the community, people are doing things that they need to do, that meet all the federal requirements for being exempt. So to maintain our California exemption, you have to be 2 times the minimum wage. The 8 to 9 was a smaller number of individuals. Going from 9 to 10 will probably impact a significant number of folks who are in that frontline supervisory, so it becomes an unfunded mandate for us in order to maintain the services that 280,000 people need in the community. Finally, or one of the questions that was out there is, was raised, is they funded the mandated costs. We do provide a very small contribution to retirement for our staff. That was disallowed when we submitted for those few people that I had who are in that category. Would it have made a change in my rate? Not significantly, but philosophically, the state in their budget ask number 1 says, our retirement plan went up, we need to fund that. So I see, again, a differential between those two. And finally, the minimum wage is both a federal and a state level, but it's also a local issue. And right now in the Bay Area, we have a significant number of cities who've decided that $10 would be great, but San Francisco's at 11 plus. Oakland just went to 12, San Francisco's going to 15. Santee has the experience of San Jose going to that, and we don't have a mechanism in place to deal with that. And so one of the major issues that we face is, as everybody jockeys for MI first, how does the state sort of provide that augmentation to us? Right now, it's through health and safety by individual consumer. It's not we can submit for all the people in Oakland, here's how we get that. So right now, we know respite agencies that are in significant danger of going under to cover that cost they have to put out with no way of getting that money back. So I think that's a major concern of how do we as a state deal with those changes that are not necessarily driven by you or the feds, but other very well-meaning individuals who want to make an impact.
It's the unintended consequences of trying to address the issue with one group of people, kind of a ripple effect.
Right. And the other one I would comment on the core staffing formula and operations, there's 2 adjustments to that. They're getting those from $9 to $10 based on $19.91. I doubt any regional center is actually paying someone less than $10 an hour. That's what the core staffing says. So I think that's one of those things where, again, how do we address those issues? And again, thank you very much for the opportunity to try and shortly and quickly represent a lot of very, very important people in our community.
Thank you very much for doing so. Senator Stone.
You brought up a number of points that I was going to try to make, and certainly those core staffing level salaries, again, needs to be reflected in 2015 dollars, so we have an idea of what we're truly needing to fund these agencies. But we do see trends like in Oakland and San Francisco where they're picking up their own minimum wages. I think Los Angeles County is considering the same thing. And I would assume that those increases, and also that's going to be doubled for certain managers within our programs. So I guess this is for kind of the LAO. Are those reflected in the the governor's budget? I have a feeling that they're not. And also, will these higher minimum wages and management wages, are they going to be creating compaction issues in other areas, where we have these unintended consequences that we learn about probably next year? So.
Senator Stone, the governor's proposal only addresses workers who currently earn less than $10 per hour. It makes no adjustments for the wage compression issue for individuals slightly above $10 per hour, and it also does not address exempt employees who are required under the labor code to receive at least twice the minimum wage.
Okay, so because I'm new to this process now, we got a committee that's found a flaw, if you will, in the system and how we fund a very important facet of state government. Is it the LAO now, or who goes back to the governor and says, well, Governor, we appreciate the increase that you've given us, but here's the reality of the situation based on factors that we don't control? So do we get the information to the governor where he can consider that when we come back to the May revise, where we might see some reflection on those realities, instead of it becoming, again, another hit, another concern for people that are in the audience saying, don't cut my services?
Senator Stone, our office recently became aware of this issue about the employees who are under exempt status having a requirement to be paid at least twice the minimum wage. So our office is continuing to evaluate that issue.
Okay, and you will examine the compaction potential issues, because you may have other, I would assume, collective bargaining issues where they have compaction issues written into their agreements that might reflect even a higher cost for other employees.
Certainly, we will take a look at all of the individuals who may be above the minimum wage as well as exempt employees.
Thank you very much.
Sure.
Thank you. We'll move on to issue number 7, statewide self-determination program. Again, reviewing the governor's proposal. And again, just remind my colleagues, we're holding items 4, 5, and 6 open for May revise. We'll be joined for issue 7. Again, it's the governor's proposal we'll be reviewing, but the panel will be joined by Marty Omamoto, Director Founder, the California Disability Senior Community Action Network, and we'll start with the department.
Hello, Nancy Bargman, Deputy Director of the Department of Developmental Services. Thank you for the opportunity to speak on the issue of self-determination today. Just by way of background, I'll give you a definition of self-determination as well as some history related and moving forward to our current program. Self-determination represents an alternative model of service delivery where individuals are empowered to control and select services and supports to meet their own needs. Self-determination was first introduced in California in 1998 under a pilot program in California that was through 5 regional centers and the associated area boards at that time. Initially, there were approximately 150 participants. Presently, there's 110 participants in the current self-directed program. Despite efforts to secure federal funding in the past, the current program is supported by state general funds. Senate Bill 468 was introduced and signed into law October 2013. This law states that the self-determination program is authorized to fund only services and supports that are eligible for federal funding and shall be cost neutral. It is to be phased in with the 2,500 participants in the first 3 years. The department embraced the stakeholder process in developing and implementing self-determination in California. We are very pleased that we have a very informed and committed stakeholder group. Because of that, they were willing to work over the last 12 months in this process with us. We did have 20 different self-determination advisory group meetings as well as sub-work groups. So as you can see, it's been a busy year. We are pleased to report that the self-determination application was submitted to the Center for Medicare and Medicaid Services, and I'll just reference it going forward as CMS, in December of 2014, which is consistent with state statute. On January 13th, CMS provided feedback to California regarding the status of the application. The feedback included 2 items. CMS was requiring that the application be posted for public review for 30 days. Further, CMS required clarity regarding the new federal requirements. Although the self-determination application was submitted with this information within the body of the application, CMS is asking to have the detail defined in a very specific section and identified in that section. This particular section is currently under review by CMS. Upon approval, we will repost the application for the 30-day public comment period. At the end of the 30-day comment period, we will then have CMS will have the opportunity to review for up to 90 days. It is difficult to really predict the time frame in which the approval may occur of the application. However, the department is very committed to being responsive to CMS upon any point that they have questions or would like further clarity on our application. The federal waiver approval is necessary in order to achieve general fund savings to support the administration of the new self-determination program. The savings is achieved by moving the 110 individuals receiving services through the state-funded self-determination services through our current program. As written, the 110 participants will automatically be enrolled in the federally funded self-determination program once approved if they choose to continue to direct their own services. As a result of this transition, it is anticipated that we will have a general fund savings of approximately $2.8 million. Although not fully identified, some anticipated costs to support the administration functions of the program could be fingerprint and background check requirements, IT systems, as well as regional center administrative costs. In addition to obtaining federal approval, there is still work to be done regarding the implementation. Current priorities is that we are working with the Self-Determination Advisory Group in developing outreach and training materials that will be effective statewide, recognizing that the importance to ensure that effective outreach to our diverse community is achieved. All outreach and informational training materials will be translated in multiple languages and be user-friendly. Establishing the 21 local advisory committees is also a priority for the self-determination work group and for the department. The 21 local advisory groups are in various stages of development at this time. Representatives from the Department of Developmental Services, ARCA, State Council, and DRC are scheduled to meet this month to establish a definitive date for establishing all local advisory groups. The continued work of the Self-Determination Program Advisory Group is really critical to the success, not only for achieving approval of the application, but also for implementation of the program.
Can you tell me how many are currently existing?
Currently,
The advisory committee?
I don't have the exact number that are currently existing that are in operation at this point. We will have clarity in a couple of weeks as to what that status is.